basically stands for gastroesophageal reflux disease. Before I explain what Gerd is, let me show you the anatomy of the parts involved in Gerd. So in this diagram, you can see the esophagus, the long food pipe that connects your mouth to your stomach here. Between your stomach and your food pipe, there is a sphincter here that opens and closes when food passes through. So when you get acid from the stomach going up to the esophagus, the reflux or the backwash of the acid, it irritates the lining of your esophagus and produces the symptoms that you get with Gerd. So when you swallow, a circular band of muscle around the bottom of your esophagus, we call that the lower esophageal sphincter, it relaxes to allow fluid and liquid to flow into your stomach, and then the sphincter closes again. But if the sphincter relaxes abnormally, the stomach acid will flow back into your esophagus. This constant backflow irritates the lining of your esophagus and produces the symptoms you get with GERD. Heartburn is the most common symptom of GERD that patients present to me with. They always complain like a burning sensation in their chest around here, especially after a large meal or after they lie down after a meal. Sometimes patients complain in their own language like pedih, lulu, hati. This is the common symptom that patients present with Gerd. It's normally relieved with antacids, and a lot of times these symptoms can be also mistaken for a heart attack. They can be quite similar. Apart from that, patients also complain of regurgitation of food into the mouth. They feel like a sour liquid taste in their mouth as well. Sometimes they feel like a sensation of a lump in their throat, and some can present with difficulty swallowing as well. They feel like the food is getting stuck at the lower part of the esophagus. This is because the constant acid reflux into the esophagus can form scar tissue and then make the passage of food a bit difficult to go through down into your stomach. Patients can also present with respiratory symptoms or ENT symptoms. They can present with chronic cough. They can present with sore throat and hoarseness of voice because of the acid disturbing the voice box over here. If you have asthma, it might worsen your asthma with reflux, and also it can worsen your middle ear infection or precipitate sinus infection in certain people. Most importantly, it also disturbs the sleep quality of patient as well. So a lot of times patients come feeling very tired and lethargic with reflux symptoms. The main risk factor for Gerd is basically obesity. The increase in weight in your belly area creates a pressure on your diaphragm and relaxes the lower esophageal sphincter. This aggravates GERD symptoms. Pregnancy is another very common cause for GERD because the pressure from the baby, the fetus, also relaxes the LES muscle and aggravates Gerd symptoms. The other common cause for GERD is hiatus hernia, where part of the stomach bulging into the chest cavity, and this also can aggravate GERD symptoms. Medication that you might be taking also can relax the lower esophageal sphincter or irritate the lining of your esophagus and worsens the symptoms of GERD. There are certain disorders that can also slow down the movement of your esophagus and your stomach and the clearing of the acid from the esophagus and produce symptoms of GERD. Diseases such as long-standing diabetes, which are not well controlled, can worsen GERD. Parkinson's as well can slow down the clearing of acid from your stomach and your esophagus and produce GERD symptoms. So it's very important that you tell your doctor your medical history, the medication you're on, so that we can tailor your Gerd treatment accordingly. The mainstay of treatment and medication for Gerd will be lifestyle changes. I normally tell my patients to lose weight if they are obese because this aggravates their Gerd symptoms. Also, to avoid any food that can worsen Gerd, especially oily, spicy food, avoiding large meals as they can aggravate their Gerd symptoms as well. I normally advise my patients to take small regular meals so that they do not worsen their Gerd symptoms, to give a space between 4 hours between eating and sleeping as well, and to elevate the head of the bed about 30 degrees or using 2 pillows so that it does not worsen their Gerd. I also tell them not to wear tight clothes or belts that can worsen their symptoms as well. Apart from lifestyle changes, then medication that we prescribe for patients or to relieve their symptoms as well. The mainstay will be PPI or proton pump inhibitors that reduce the acidity production from the stomach. This is either given once or twice a day, and we normally give it for about 2 to 8 weeks. And I normally tell my patients to taper the medication as they go along, because GERD is a chronic condition and you only need to take medication as and when you need it in the long run. But let's say if you've done all this and your symptoms are not getting better, you're losing weight, you're having difficulty swallowing food, you have blood loss, then you will need further investigation as well, such as endoscopy to check the esophagus and the stomach for any cancerous lesions. This will require you to consult a gastroenterologist for further investigation and proper management of your GERD.